So here's our group. All of you, of course, should know this page. If you don't, please ask. We can get you connected. This is a great source of information for what we do in medical English. It is the Facebook venue. We have a Telegram group as well. I have posted a couple of things today here that I just want to show you. Here is vocabulary, observation vocabulary. I'm just going to click on this and let you see where it takes us. Okay. So I'd like to spend maybe a half an hour tonight using this text and then showing you some cases. I started writing some things tonight just in the automobile before I walked in. Look at these words. Let me just read these words, and then I want you to ask questions about what hits you. These are not the medical words. These are the razgovorny words, conversational words in English, okay? So rash, rashes, spot, spots, patch, patches, scratch, scratches, to scratch, to itch, an itch, blotch, blotches, okay? Then we have some verbs: to emerge, to appear, to develop, to progress. Can everyone see this text, or do I need to enlarge it? Is it okay? Good. To develop, to progress, to fade, to reduce, to go away, or to disappear. Next line: to merge, to come together. Now, here's the medical word: to coalesce, coalescence. Okay, we have things like color. Below you see red. The medical erythematous is classic. We have color, bumps, lumps, whelps, blisters. What's the word bruise? We could even put it here, but is it really a dermatologic condition? What's a bruise? It's trauma. It's signac. So it's about hemorrhage in the skin. That's очевидно. That's clear, right? So that's not a rash. See the difference? So as you look at what we're doing tonight, we're trying to talk, trying to talk about the skin as an organ and what goes right and wrong with the skin tonight, and develop the words and the description of the English, medical English, around those ideas. So a bruise is not really, I'll put it in brackets here, it's really not quite in the category of what we're doing tonight. Then we have things like itchy, scaly, weepy. Some things come and go, some things are persistent. Now, what are your questions with that list of ideas? I'll give you a couple of questions. Anybody? You understand all that?
I don't know what is lumps. Yes.
All right. Okay. So when I came to Ukraine and started driving an automobile, I noticed that you have a lot of speed bumps in the road. You also call them mordvik полицейский. So ležущий полицейский, да? So you have these asphalt things in the road. We call that a speed bump. All right, B-U-M-P. Here's another idea. If I say, oh, I've got something wrong. Doctor, I've got something wrong here. I feel a bump on my skin. This means it's usually round and like a little, what would you call it? Nigora? Gorbik. Okay, that's a bump. Now, if you're talking about the breast, and a woman comes to me and says, Dr. Crane, I have found a breast. It's not a bump, it's a lump. Опухол. Что-то неправильно, внутренний. So if it's inside the skin, we call it a lump. I haven't even put that here because generally that's a subcutaneous idea. It's not dermatological. But lump and bump are sound-alikes, right? So you got bump. Okay, so what about whelps? and blisters. I'll show you pictures of all this tonight, but a whelp is just a large flaring of the skin, some fluid developing in the layers of the skin. If I said urticaria, would you recognize what that kind of looks like? So that's a trigger word for those of us in clinical medicine who've seen that. What is urticaria? Reaction?
Reaction, yes.
Of the skin?
With small...
They're your medical words. Some of you know the medical, but you don't know the razgovorny. So I wanted to start with the conversational words tonight. People talk about a whelp, but doctors don't talk about whelps. All right, we talk about wheals. Let me show you a wheal. Let's just pull up. One of the things that I heard from your leaders in OMSA was that if you search by images, you see what I just did? I have a Google search page, and I just opened this, and up here you have your account and your different functions and applications. But right here you've got the tab images. Maybe you have this in Ukrainian, but if I look for wheel, wheel. Yeah. What about the wheels on a car? Wheel. It sounds the same, basically. So these are wheels. So if you take this unfortunate person right here, okay, those are wheels to the doctor and whelps to my mother. She'd call those whelps. So if you look carefully, you'll see little islands where you have normal skin here, but then here is a large geographic island of swollen skin. Please come in, welcome. It's an area of swollen skin. We call that a whelp or a wheal, okay? Now the condition that drives this is usually of the allergic category and could be eczema or urticaria, okay? Tonight we're teaching more about the words rather than the diseases, but I'm happy to talk with you about any questions that you have. While we're here, what's the main difference that you notice between the normal skin and the affected skin? I won't say diseased skin because this may not be a disease. It may just be an allergic reaction. And we don't always call allergies diseases. So I'll say affected skin or involved skin. So what's the main difference that you see right away between normal skin and affected skin? Redness, that's it. Color. So the first thing that you must think about is color. It's a very important descriptive starting point for the doctor. If I'm on the phone as a GP or a therapist and I'm calling my dermatology consultant, I'm saying, Юлия, это Jeff. Пожалуйста, у меня пациент для вас. Можно сделать консультацию сразу, сегодня? So the first thing I say is, she has developed. Now, how would you call this color? Computers are not very good, but we get approximations of color. What color is this? Pink, salmon, excellent. I didn't hear red, and I like that. It's not exactly red, right? This is green. This book I gave you, Fitzgerald, this is red, okay? This is red, right? This is green. That's not red, right? That's pink. So you have to start with color and be very accurate with the color description. So it's pinkish, pink or pinkish salmon color. This is a very classic way we describe this in English. It's salmon. What's salmon? Okay. Вашим языком? Лосось. Right. You know that meat, that fresh meat is a bright pinkish color, right? Okay, and then you have more descriptions about other things. So let's go back now to our text and begin what I want to show you. This document is available to you online. It's on our Telegram Google Drive link. It's on the Facebook files. Okay, so you can find this. But let's just begin with primary skin lesions. And I've adapted this list from Up to Date. So I will just read, and then I want you to ask questions with this first page. Macules are non-palpable lesions less than or equal to 1 centimeter that vary in pigmentation from the surrounding skin. Patches are non-palpable lesions. Let's actually highlight this. So a macule is a non-palpable lesion, it's less than 1 centimeter, that varies in its pigmentation from the surrounding skin. A macule is not raised, it's just flat and it's a spot. That's an excellent way to describe it, it's a spot. Как на русском? Пятно. So a patch are non-palpable lesions greater than 1 centimeter. So what's the difference between a macule and a patch? Size. Exactly. So let's start tonight by fixing in our minds the words macule and patch and understand that they are not raised. Everybody clear with that? Next step, papule. Papules are palpable. What does that mean?
You can differentiate.
You can feel it with your finger. Palpation. So palpation is a critical skill for all of us to have, and you do that with your fingers. You can do that with a papule, you cannot with a macule. Okay? These words will serve you very well all of your lives if you fix them in your minds, okay? So a papule is palpable. They are usually lesions less than a 5 millimeter size. They may be isolated or grouped. What does isolated mean? One, some, all alone. Grouped means in a group. What does cluster mean? That's a good descriptor. A cluster is many in one place. Plaques are large, superficial, slightly raised lesions, often formed by the confluence of papules. Now, what is confluence? Yes, think about rivers. If you have 2 rivers,
Yes.
and they're coming from the mountains, right? And they're coming from different areas of the mountains, and they come together, that's a confluence. Co-flow. So it's confluence, it's a flowing together. That's an idea in the skin that serves you very well. I've already mentioned another word on the other page. Do you remember what it was? Coalescence. We'll come back to that. But confluence and coalescence are the same idea. Okay, nodules are palpable, discrete lesions greater than 5 millimeters. Sorry, what's the difference between a papule here and a nodule size? So a nodule is larger than a papule. All right? Any questions so far? Any words that you're not understanding? This is getting deep here. I'm going to keep going. We got another whole screen of this. So let's make sure you're seeing, and then I'm going to throw pictures up, and I'm going to ask you to use these words to tell me what you see. I'm going to help you become dermatologists tonight. Okay, if I have a broken or an old coat, this is 30 years old, and I've worn it a lot, and on the farm I have rubbed my elbow, and there's a big hole. I would take a piece of cloth, and I would put it there, and I would sew it. That's a patch. Okay? If we do tymplanoplasty, and we put in an ear tube or a plastic canal for a baby who is, well, a child who's 2 years old and recurring ear infections, and you must drain the gnoi, pus, from the middle ear. You put in a plastic tube, and that allows fluid to drain from the middle ear. In 5 years or 4 years, if the child's allergies and facial development has grown so they're no longer getting infections, you take that tube out. There's a hole, and you can do a procedure to patch that ear. You take a piece of skin from somewhere around there, and you lay it on the tympanic membrane, and you patch the hole. So it's a patch, sуществительное, and 2 patch, глагол.
plaques and nodules.
Okay. Plaques and nodules. Is that what you're asking? Plaques?
Yes, plaques.
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 Okay, let's show you a picture. I think picture's worth 1,000 words. What is that white thing right there? Yeah, that's scale, scaling skin, right? This whole thing is like an island, right? But we would describe this as a raised erythematous color plaque with superficial white scales. You see what just happened? You can give measurements on a centimeter scale of how large it is. So it's a plaque, and it is an area of raised skin. Is that clear? Now let's go back to our words. A plaque are simply larger than 5 millimeters, superficial raised areas, often meaning not always, but most of the time, formed by the confluence of papules. Are those papules? What are those? What are most of those that you see? Papules or plaques? Most of these are plaques, also called wheals, in the context of allergy reactions. If it happens over 5 minutes, it's a wheal. If it happens over 5 weeks, it's more chronic, and therefore you'd call it a plaque. See the difference? So a telangiectasia is a dilated superficial blood vessel. Вы знаете, да? Понятно. Purpura, plural, множество число, are red-purple lesions that do not blanch under pressure. What is blanch? Бледнит. It becomes whiter. When you take a piece of glass and you put it on the skin and push, it becomes white or more flesh color and no longer red or color. So that's blanching. Purpura do not blanch under pressure, resulting from the extravasation of blood getting out of the blood vessels and spreading through the skin. That's extravasation. From cutaneous lesions into the skin. Purpuric lesions can be macular or raised. And there are certain conditions that you all will learn in your medical careers that are related to palpable purpura. Okay, pustules. Moving on. Pustules are small, circumscribed skin papules containing purulent material, whereas vesicles are small, circumscribed skin papules containing serous material. So what's the difference between a pustule and a vesicle, other than size?
Containing material.
So the pustule contains pus, gnoi. The vesicle contains clear fluid or serous fluid, thin fluid. Может быть мутный, но может быть прозрачный. Okay, so it may be transparent, it may be clouded, but most of it is pretty much like serum in the blood, clear, mostly clear. That's a vesicle. A bulla or bullae are large vesicles. Wheals, we've already discussed tonight. They're irregularly elevated, edematous skin areas that are often erythematous. And this is a classic picture of that. Okay. The borders of a wheal are sharp, but not stable, and they may move to adjacent uninvolved areas over periods of hours, even minutes. Now, произношение, после меня, macules. Macules. Patches. Papules. Plaques. Nodules. Telangiectasia. Telangiectasia.
Ramification.
Purpura.
Purpura.
Pustules.
Pustules.
Vesicles.
Vesicles.
Bullae.
Bullae.
I heard boule, and that's okay. It depends upon where you are in the United States. For American pronunciation, you'll hear some people call it a bulla, but I say bulla, not boo, but bull, bulla. Bleak is a male cow, right? And we call that a bull, and that's the first part of that word. So bull is how I start that, bulla. Okay, bulla.
Bulla.
Wheels.
Wheels.
Okay, now, okay, who wants to tell me what a purpura is? You want to start? What's a purpura?
Purpura is palpable and skin.
Okay, not always. If it is, you might have thrombocytopenic palpable purpura, which is a special skin condition. Let's go back to the basic definition. Purpura is,
It's about more than 5 centimeters.
okay,
And it's have another color.
good. The key thing about purpura is it's red purple. So for me as a doctor, the way I learned this was purpura is purple color. Okay, so it's about color first. That's the first thing to remember. And usually purpura they're small. So they can be macular or raised. What's a macule, Andre? Look at your first sentence. It's less than a centimeter, and they vary in pigmentation from the surrounding skin. Let's go ahead and show you a case right now of that. Okay? You probably know the diagnosis of that, but let's not talk about the diagnosis. What's the main difference between the lighter skin and the darker skin? Pigmentation. So there's a difference in pigmentation, and this central area is kind of interesting. It's a lot of it, but then you have these things out here that look like little pizzas, right? Most of them look like round spots. Describe to me what you see. Describe what you see.
Okay, it's a coalescence of the macules are around.
Isolated macules are around the area of coalescence. That's good. So the fundamental issue is a macule, not a papule. These are flat. And the feature about color, in this case, is they're lighter colored, and they are probably not pigmented. So these are non-pigmented, light-colored macules, many of which are between maybe 3 and 7, maybe 10 millimeters in size, with central coalescence. See what we just did? Now, what do you think causes this? If it were congenital, we'd call it vitiligo. And this is infectious disease. Okay? But vitiligo looks like this. I'll show you a picture of vitiligo next. You can see the difference in that vitiligo is more stranded and linear in its edges, not little pizzas. Sometimes. But sometimes it's rounded, and sometimes you can't tell. If it's on the hands, it's probably vitiligo. If it's on the back, it's probably this. Only clinical experience will start telling you those kinds of things. What do you think causes this?
I don't understand when we spoke with the child.
But this is medical English. So you have to give it to me in English. What's the fundamental cause? What's the causative agent? Category, not a virus. Gribok, right? What's gribok in English? Fungus, right? So, после меня, fungus, fungi, that's 2 or more, right? Mycosis. Now listen to this. Dermatomycosis. Okay, this is a dermatomycosis. It is one of many fungal infections of the human skin. Of course, cats and dogs can get them, lots of zoonoses, but we're talking about human disease today. So this is a dermatomycosis. Mycosis, myco is gribok. So when we say dermatomycosis, our English understanding is we're talking about the fungal skin infections. And that's a good idea to put in your mind, is dermatomycosis. So this one's called tinea versicolor. Tinea versicolor. I need to bring up a new, actually what I'll do is I'll put it on our thing tonight. I have some questions for you. I'm going to go down here, draw a line. So dermatomycosis. An example of this is tinea versicolor, which is also known as pityriasis versicolor. So here is your classically correct word for medical English tonight. That's what you've got to remember, pityriasis. So let's look at this list again of words that I've given you so far. And I'm going to show you the bottom part of this page, okay? Because we're going to go to secondary skin lesions and looking at these sorts of words, excoriation, lichenification, edema, scale, crust, fissure, erosion, atrophy, scar, hyperpigmentation. So we're going to go into a process of secondary problems. Let's go back to our list of primary problems and look at these again. Let's review again. A macule is a spot. A papule is something you can feel, a little bump. A plaque is a large island of something you can see and feel. It's raised above the skin. A macule is not raised above the skin. A nodule is a bump. It sticks up above the skin, and it's usually pretty discreet. And the idea of nodule means it's usually pretty firm. A nodule is not a blister. It is not a pustule. It is not a vesicle. A nodule is firm, whereas pustules and vesicles have fluid in them. On that regard, a pustule has pus in it, whereas a vesicle has serous fluid in it. A very large vesicle is called a bulla. If you have lots of them on your skin, you have bullae, the plural in Latin. A wheal is a fast developing geographic. A wheal is often from urticaria or an allergic condition or eczema. See if I can ask you, what do you see here? Yeah, multiple papules. I love that. That's exactly where I would like you to start. Those are multiple papules. If I said vizdia, how would you say that in English? Good. Both of them are correct. All over, widespread, all over the body, or all over the back. Is this an adult or child? Look at the hands. Yes. Yeah, so you're probably seeing mother's hands holding a baby for the photograph. See that? Another context clue. Now, you're noticing some of these individual papules, like that one right there, or this one right here. Some of them are doing something like this. In fact, most of this is this. What is the English verb that I've taught you? Coalescing. They are coalescing. That's a continuous present tense verb. They are coalescing. That means that it's in process. Okay? I am standing up here. I am talking to you. It's going on. It has gone on already for 40 minutes, and we are continuing the process. Those are our lovely present continuous verb tenses. Classically, in a rash that is changing, we are going to be using present continuous. I can't even talk about it without using the present continuous voice. So, some of these papules have coalesced. Present perfect tense. See the difference? They are coalescing. They have coalesced. Same basic idea. In fact, to say that they have coalesced, papules are palpable, usually small. Sometimes they coalesce. In the picture, and I'm going to tell you of what in a minute, give you a diagnosis, we see the papules coalescing. See? I'm going to make this document available after the lesson tonight or tomorrow. I'll post this. So, okay, now what's your diagnosis? We haven't talked about color yet. So, Deacon, tell me from the beginning, what's wrong here? Tell me, Dr. Crane, I have a patient. Let's pretend we're on the wards now, on the rounds, okay? You've just walked into a patient's room and you're walking out. I'm the attending standing in the hallway. You're the junior resident and you're reporting to me at 5 o'clock in the morning on rounds. What did you just find? You start with a sentence. Dr. Crane, the patient.
The patient has multiple red and widespread bubbles that are there. Some of them are coalesced.
Good.
And
That's excellent. You've done perfectly well. That's great. Now I'm going to ask you some questions because the attending wants to know the following. Does the patient have a fever? The answer is yes. This patient does have a fever. Do you see any vesicles? We don't really see vesicles, right? No vesicles. Most of these, this one right there's a little suspicious. But I won't give it a clear little blister. It's not a blister. It's not a thin walled, and that's the key. A blister or a vesicle has a thin wall, superficial dermal layer. These are papules. So if you get your first description right, it gives you your differential diagnosis. So no blisters, all right? Any exudate?
no.
Okay. So the question about blisters is about varicella, chickenpox, right? The question about exudate is erysipelas, infection, rapidly developing infections of the child. Not like this, but more about the eyes, nose, or mouth. What's your diagnosis?
It's called fever.
It could be, but it's not. It's in the question mark. It's in the differential. Child with a fever that's developing this rash over the course of 4 days, 2 to 4 days. It could be an allergic dermatitis to mother's new laundry soap. It could be. But usually this picture in a child with this particular, it's the viruses that are causing measles. This is measles. Okay? So this is Kyiv. Okay, but this is measles. This is classic core. Any questions here? All right, let's keep going. So let's review our words again. Who would like to read a couple of sentences? Maybe one that you don't know so well. Maybe just read the text. You can choose whatever one you'd like.
Nodules are a palpable, discrete lesion measuring less.
No, that's greater than.
More than 5 millimeters in diameter. they may be isolated or grouped. Tumors are large nodules.
Okay, so you get the idea that a tumor is a large nodule. So let's just take a moment to do a little search with Google Images. You see up here, I'm going to search here. Large skin nodule. Oh, what do you call that? Опухол? What if it's внутренний? If it's inside, deep, and you feel it, but you can't see it, is there a difference in what you call it? Intradermal. So this is a nodule, right? Nodule. Okay, so let's go back to our, any questions from anybody at this point to distinguish points, because I really want you to get these basic initial primary skin lesions down. This vocabulary is critical, and in fact, I wish that I had learned these really well when I was 25, 30 years old as a young doctor, because I've struggled throughout my career to describe dermatology lesions quickly and immediately and well. If you see a process, okay, let's throw another picture at you. Let's take this one. If you see a process like this, give me an immediate description. Let's give this one to you. Can you tell me what you see?
I see.
Okay. We'll start with the idea of color.
Red.
Red. Papules, you said.
Yeah.
Yeah, all these are rashes. You can't say rash because we're talking about rashes tonight.
No,
All these
I
things,
see it.
all these things can be rashes, and that's a worthless term to a doctor. If you said, "Doctor, I have a rash," well, then that means you're a patient and you're coming to the doctor for advice. If I call her and I say, "I want to send a patient to you with a rash," she's going to say, "Okay, Jeff, what kind of rash does the patient have?" She's going to want more information. So we probably don't want to say rash. Red is right. Papule is right. Keep going. Papule means we can palpate it. We can feel this. It's raised above the skin. I'm going to point to some features with my pointer, but I'm not going to say them. And I want you to try to give me the English about it, okay? There's no shame here at all. Just do the best you can. Just give me what you can. Okay. So is that one right there. And this one right here, palpable. But there's a feature here I want you to talk about. All right, just to review, these are papules. You're telling me that, let's see, where did I lose it here? You're telling me that these are also papules. What I would agree with you that that's a papule, and maybe that's a papule, and maybe that's a papule.
It's vesicles. It can be vesicles. Those which are with white color in the center. No?
Okay, yeah, but that one right there is a little different, isn't it? It's like a little volcano, and something black came out of the middle of it.
Right.
Well, brown. This one's the same way. And this one's the same way right there. Can you see that on the screen? All right, so if you look at this right there, that's the most classic one. That papule is different than this papule, right? So I'll give you that, I'll accept that papule works, but there's a bigger picture here. What's?
It's rounded, isolate, annular.
Keep going.
Annular polymorphic mesh.
It's basically annular, which means circular. There is a pretty normal area of skin, and there's a pretty not normal area. And these are what? Krai. Krai. Tell me about the krai.
Border.
Border. Edge.
Between healthy skin and
Affected or diseased skin is so there's your word, well circumscribed. Chotny, chotki, well circumscribed, very, very well delineated, 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 well circumscribed, well delineated. Those are classic dermatologic descriptive adjectives that tell us that there's a big difference between normal skin and the diseased skin. Well defined. So the border is what we're talking about. Okay? Let's go back to the picture and let's look at this one because it's pretty much the same kind of thing, except this one's nastier, right? You have the same kind of this round thing, right? Annular. And the difference between normal skin and diseased skin is pretty well defined, well circumscribed, well delineated, well defined. Okay, those are great words for you here. Okay, so let's go back to the first one I showed you and let you keep going with that. Who would like to help her? What else can we say about this? Is it a macule? No. Why not? Why is it not a macule? It's palpable. This is raised above the skin. Macules are not. Okay, good. So this is raised above the skin. Let's say the measurement of this is 7 centimeters. Well, let's give it 3 centimeters. Okay, let's go back to our vocabulary and let's see what a 3 centimeter area papules are palpable, less than 5 millimeters. 5 millimeters now, not centimeters, right? Plaques are larger than 5 millimeters. Superficially raised lesions often formed by the coalescence of papules. This looks like a patch to me. I mean, a plaque. That's what I meant to say. I'm sorry, plaque. So let's go back and call it a plaque and keep going from there. So let's call this a plaque made up of individual papules. The whole thing is annular, round, well circumscribed. Color, please. Good. Okay. Now, there's some feature here that I want you to talk about. What about this area of white here, here, there? There's a little bit of something going on right there. Yeah, exactly. Now, before we get to the terminology, can you volunteer a suggestion? What do you see? Excoriation? That would mean I scratch the skin and there's a line, a linear scratch, excoriated skin. This has the sk sound in it. It's scales. It's scaling. There you go. And we showed you, maybe you got a glimpse of that here. This one is just nasty. Let's go back to that is similar, but it's not annular. And there are not so many individual papules. There's one, but it looks a little different than what we saw earlier. The prominent thing is all these white scales, right? So this is scaling. What's the diagnosis here? What is this? This is psoriasis. Psoriasis. So, plaques with scales. Think psoriasis. Okay, psoriasis. There's psoriasis, there's psoriatic arthritis. Psoriasis is a systemic disease. It's not just a skin disease. Is it enlarging over time?
Is it enlarging over time?
Or you could simply ask what you first did. Is it getting bigger?
Is it
That's the most common way we would ask. I don't think it's enlarging. At least it has not for the past 3 or 4 years. I began to notice it maybe 5, 7 years ago. It's gotten a little darker, but it really hasn't enlarged.
And what my doctor said about it?
I am the doctor. I don't go to doctors. I ask myself the question. No. Let's keep thinking. What else would you want to ask? Good. Does it hurt? So is it painful? Is the way you start with the verb is. Is it painful? Does it hurt? No, it does not hurt.
Does itch?
Good. That's what I was waiting for right there. Does it itch? What does itch? No, it does not itch. So it is painless, and it does not itch. We don't say itchless. We say it doesn't itch. Crazy. What's another important question about cancer that you want to ask me?
Family history. Does the border is sound or it is?
What you're wanting is present perfect tense. Has it changed? Has the border changed? Has the shape of the border changed over the years? No. It's always been kind of tetrahedral, or 1, 2, 3, 4, 4 sided. It's always kind of worked like that. Yeah, polygonal. Yeah. But there's another important question that family history, no family history of skin. My mother and father had some facial skin cancers when they were 85 years old. But I probably will too. You probably will too. Yeah, that's not necessarily genetic. It's probably science. What about bleeding? So you want to ask me, has this ever bled? Or does it bleed? No, it has never bled. It does not bleed. So we say that in English both ways. Is it bleeding now? No. What's your bleeding? It's not bleeding now. Has it bled? Appearance. Obvious. Obvious. Appearance. Appearance. A-P-P-A-R-E-N-T. Sure. That's why we're here. So ask anything you want. Huh? But you know, it's interesting. It's like there's something going on. I think I've got another one on this arm somewhere. Certainly something's going on right there. That's new. That one's new right there. It's beginning. It's kind of the way this one started. It was very light color. That doesn't blanch, doesn't change. So this, that goes there. This. Another question you want to ask: were you ever burned by a chemical? Right? No. No. Then somebody asked, was this wrong? That's kind of this category thing. So what's your diagnosis? Okay. Yeah, age-related hyperpigmentation. Exactly. It's called age spot. It's got a fancy name. It's just age spots. Patients come to us, they ask us, and we tell them, forget it. It's okay. It's just part of growing up. Get your diploma. Okay. So that's a classic age-related skin change. It's just it's non-blanching. It's not crusting, bleeding. I can feel that it's a little bit rougher Now I'll show you another skin problem. While we're talking about older patients, you've probably seen people with things like this on their skin. This is exactly what I'm showing you here. These are so-called age spots. And people will pay thousands of dollars to have doctors treat these things and try to recover their youth and look beautiful again and try to stop the aging process. So you can make a lot of money from cosmetic dermatology if you want. Nothing wrong with that. That's a business. That's a good use of your skills, but I found it superficial. No pun intended. I found it not so fulfilling. I would much rather save someone from death from a pneumonia than treat the size of their breast or enlarge lips or do things that are cosmetic. That's just my preference, okay? That's just a personal choice. But these are age spots, all right? Now, let's look at the second part of our skin list here. Let's begin to develop these. Excoriation. Excoriation describes superficial, often linear, skin erosion caused by scratching. Let's keep going. Lichenification. Lichenification is increased skin markings and thickening with induration secondary to chronic inflammation caused by scratching or other irritation. Edema is swelling due to accumulation of water in tissue. Отек. Scale describes superficial epidermal cells, which are dead and cast off from the skin. Scale, which is exactly what we saw with the psoriasis case a minute ago. Crust is dried exudate, scab. A fissure is a deep split in the skin, extending into the dermis. Now, what do you not understand in this text? Crust. So a thick pie crust is tasty, and we like the taste of the crust. This one looks particularly good to me right here. So if we have exudate and crusting, you get into nasty stuff like this. So you have this or this. So this is a lip, right, with an ulcer, and inside that has been hemorrhage, and that is dead material inside. This is the same kind of thing from a gangrenous leg or a severe chronic infectious process, and this is called an eschar, a very large scab. Here's a child who's got erysipelas, and there is brownish honey-colored infection from staphylococcus, and this is especially an area of exudate where the child is going to inevitably take a fingernail and pull that off because they can't help it. They just have to do that, right? And that creates perpetuation of the scar, and it creates a chronic scar. We probably have spots on our skin where we did that as children, right? And your mother's told you, don't scratch the chicken pox. What's chicken pox? Varicella. Because if you scratch the chicken pox, what happens? It will spread, for sure, that's good, and it will also cause a permanent scar. So it's very hard to stop a child from scratching varicella. All right, so let's develop some of the words that we've mentioned. We talked about crust, comes from dead skin and exudate, fluid or infected fluid on the surface. A scab equals crust. The result of dried exudate from a wound. A large crust that is black from old hemorrhage is called an eschar. Okay, so после меня. Dermatomycosis, tinea versicolor, tinea, tinea versicolor, pityriasis, pityriasis versicolor, coalesce, well circumscribed, well delineated, well defined. Okay. Plaque, scale, crust, exudate, scab, escar. Escargot are snails. Ulitki, da. So escargot, escar, same idea, totally different meaning. Absolutely different. Different universe, okay? That's cuisine and food. Secondary changes. Let's come back to this one. What did you notice about this one and how it differed from the first one I asked you to talk about? What's happening here? Anyone? There may be some scales. I mean, I see maybe some scaling here, but I don't know if that's scaling or just crust or dried stuff. Something here, something there, and there. Almost looks like it's wet from exudate. But what is this? This is the big feature right here. Yeah, these are coalescing with pus in them. Coalescing. Okay, let's go back to our list and choose the word. Coalescing. Pustules. They are papules that have pus in them. So they are pustules. And as you look, this is well circumscribed. It probably started as a tinea corporis, dermatomycosis, skin fungal infection, which then the child infected, right? And this began as a secondary infection. So now you have to treat this for probably the bacteria as well as the fungus to get this to go away. Good news is this completely clears up and the skin will be normal after it's gone. But that pus is a secondary complication, see? All right, let's look at some others. You have a fissure. How many of you have had a so-called split at the corner of your fingernail in cold weather? Even to the point that it bleeds, right? Isn't that painful and hateful and very irritating? Yeah, that is called a fissure. Fissure, that's your word. It usually results from drying of the skin and the effect of cold weather or other chemicals to desiccate or dry the skin. To dry equals to desiccate. Sometimes fissures at the corners of our fingers next to the nail result from desiccation of the skin due to chemicals in paper that we touch.
Or not?
Okay, well, you have different meanings. Here's a pretty classic example of three of the secondary changes right there. You see the difference between an erosion, an ulcer, and a fissure? Razrif.
No, it's very rough.
So to me, this is a razrif. This is a split. This is a division of the skin layers down to the subcutaneous tissue. Okay. So it's just anatomical context. You have anatomical descriptions. The anatomical fissures are the lines of the skin, delineations and markings of the skin lines. These are
Yes,
fissures.
Yeah.
Exactly. You have fissures in the brain anatomy, right? Same word, same idea, different context. When you talk about a a secondary skin lesion, a fissure, you're talking about a very painful thing, because what's down here? It's the nerves that are being irritated by dry air and desiccation. Those nerves are screaming because they're exposed to the outside world. Okay, so let's go back and look at some pictures of skin fissures. Diabetic feet, this is a classic picture here of a diabetic fissure, where drying of the skin and maceration of the diabetic foot, fungal infection of the diabetic foot often leads to fissures. Okay, so what's maceration? Влажность, it's about water. So maceration is where you have too much fluid, too much edema present in the skin, putting extra pressure in the interstitial fluid. Yes, but the diabetic foot with neuropathy can have влажность всегда, wetness and fullness of fluid engorging the skin. That plus a skin infection with fungus often leads to the splitting of the skin where the joints are, particularly on the volar surfaces, on the inside surface. Now, what's going on here with this heel? Some of us have had this, right? Yeah, patients are going to come to you to treat this. I've had patients come to me. How do we treat this? What's going on here? This is a very painful situation. This is a classic skin fissure, right? These are crusted on the edges. You have, this is down into the subcutaneous tissue, and every time they put pressure on that, it splits open that fissure. How would you treat this? Three main things. Stop putting pressure on it so it can heal. Shave off some of the dead layers of skin and use glucocorticoid creams to try to restore the skin. And if there is any infection, you may need an antibiotic with it. But if you can, over time, take sandpaper, песочная бумага, sand the dead skin layers off, get down closer and closer to fresh skin, put maz, ointments on it, maybe menthol or other kinds of salves which moisturize the skin and allow healing to occur, and have the patient stop walking on it as much. Maybe to put some sort of a heel cushion so that the arch of the foot takes the pressure rather than the heel for the next 3 or 4 weeks. Stop the normal pressure and splitting action of pressure on the foot. You can heal this. It's easy. But people will live for years like this. So your babushka, almost all your babushki on the street out there have their heels like this. This comes from desiccated skin in the bathtub because the drain's clogged up. The sleeve of the shower, or the place where you wash your body, all of the soap on your body goes down on the floor of the shower. If the drain is not draining properly, then all that soapy water is there. You rinse off your body, you think you're clean, you step out, and guess what's all over your feet? Soap. And for the next 24 hours, it dries your skin out until you get in the shower and do it again the next day. And you step out with soap all over your feet, and it dries out. So the way you also treat this is you fix the shower drain. Chemical irritation dries the skin out. This is a classic example of that. Okay, let's keep going with our words. Any questions here about these? So you have erosion, atrophy, scar, and hyperpigmentation. We've already talked about my skin process of hyperpigmentation. That's clear. Scar. What's the difference between a scar and a scab? What cell replaces it in the scar? Normal fibroblast. Right. This spot on my thumb is full of fibroblasts and collagen deposition. right? Now, what's a scab?
Scab is the dead cells and the exudate
Exudate and dead cells,
form the up like layer.
top layer from an under process that's usually infectious or ulcerating or something, right? Good. If you have one that's this large and it's on here, it's called an eschar, E-S-C-H-A-R, okay? Okay, so we're getting close to finishing. What is this? Yeah, these are not only palpable papules, they are filled with fluid. And we're not quite sure, but this fluid is probably the most representative of the primary lesion here. You have a little blister there that's got serous fluid in it. So let's go back and describe this one right here. Who can describe that for me? Scale. I'll tell you it's a 2 to 3 millimeter size lesion, very small. I would call this more red. These particularly over here, you can see this is a little more red on my computer screen. And I can tell you, I know the diagnosis of this, and I can tell you that the color that this is a little different than the earlier viral infection that we saw, measles. So let's call it red or salmon, singular, isolated, vesicle, right. You have two of them coming together here. Then you have some secondary changes here and then here. Let's go to this one. What is this? Erosion, right. It's already an ulcer, right. So the person or the patient or the process, we don't know which, has taken the vesicle off. There's been drainage of the fluid, and now you have an ulcer bed that's forming an ulcer. The redness base, the red base is still there. When I say base, you understand I'm talking about the red base that it's resting on. And then these are two in process, right? Now let me show you another example of this same disease, and then I need you to give me a diagnosis. Hang on just a minute. Yeah, I think I've only got one picture of this. Let's give you a clinical case. This is a 2.5-year-old baby or child, young baby, young child, who has these problems developing over the past 2 days with a fever and a sore mouth. The same lesions are inside the mouth and on the tongue or on the buccal mucosa. Some are in the scalp as well. Yeah, it's varicella, it's chickenpox. Exactly. That's classic appearance. And the old saying, the way I was taught this in medical university, and I'll give it to you now, is that varicella, chickenpox, presents as a dew drop on a rose petal. Now, what's a rose petal?
It is flower.
Yes,
Rose.
a red rose. If we take this idea,
And what is you?
So dew is what happens in the mornings when the condensation of water presents drops of water on plants and biological surfaces and materials, right? So if we talk about a dewdrop on a rose petal, you have this idea. And then if you look at it as a rash, you have varicella. And there's your classic picture. Now, hopefully, forevermore, you will remember what I just showed you. Whenever you see a spot of red and a dewdrop sitting on it as the primary lesion, you have a case of herpes virus infection. Herpes viruses are the only thing that does that. So far we know, right? And you have a case of varicella if it's a primary lesion in a young child. So a dewdrop, that's the clear collection of fluid, on the red rose base in the middle of otherwise normal skin, that's varicella. Now, let's change the picture. Let's say you have this child who grows up to be 65 years old. Same child, and then develops this. You know where I'm going. Now you have a variation on that same theme. You have red bases and you have blisters occurring on them, and they're in groups, almost with linear kinds of distributions. Okay? And I'll tell you that this is along a dermatome.
Band herpes virus.
Yeah, band is like a band around the body, but what if it happens over here on the scalp and ear? It's not a band. So the band is only the idea about the torso. This is, I think, on someone's fingers. I think this is a very, I don't know if this is, I don't think it's buttocks. I think this is probably very, very small photography. But these are grouped vesicles. And what's the diagnosis? Herpes zoster. This is the secondary eruption of the old varicella virus that has harbored in the body all of the years of life, and now it resides in what type of cell? Where does that herpes virus call its home? It sets up in nerve cells, typically in the spinal cord, and then it re-erupts in times of immune suppression, depression, such as AIDS or older age, or during other illnesses. It erupts as herpes zoster. Okay, very common condition. A vaccine is being developed for adults to prevent this secondary infection. It's very much like the original varicella vaccination. Okay, so a few questions for you, and let's sum up tonight. What is ringworm? Okay, let me write it. What? Let's go back up to the top where I had some questions for you. Questions. What is ringworm? Ringworm. Okay, this is a ring, and you know what a worm is?
Yeah.
Червяк. Okay, so a ringworm, it's tinea corporis. It's this same lesion right here. This is classic ringworm. And there is no worm at all. It's a misnomer. Okay? So a misnomer is an incorrectly named thing. Let me try to give you this. It is not a worm. It is a dermatomycosis tinea corporis. It's a misnomer, an incorrectly named disease. Now, that's a разговорный, conversational term. Doctors would never do that, but every doctor in America knows what ringworm is. Can you feel? Yes, I did. Feel an itch. Yes. Can you see an itch? No, not unless the patient is scratching. And that's the word I wanted to develop, scratching. So itchy is a good adjective form, and this is exactly how we would use this in the English language, right? All right? Was this helpful? Okay, what was the best thing we did tonight? Help me understand how to improve what we're doing this spring. What was the best thing we did? Uh-huh. Okay, that's what I'm hearing. That's what I did not do so well last year. I'm trying to give you new text so you can see the words, learn the vocabulary, and then use it and have you talk back to me with it, right? Right, right. Yeah, now let me show you, let's see if I can, let me just tell you, we sat and talked about our medical English project and how we can improve a little more of a regular pattern of what we're doing. And so I think we decided that clinical cases would be on the 5th Thursday of the month. So this particular month had 5 Thursdays, and this is it, the 30th of January, right? So next month is February. There will only be 4 Thursdays. So we probably won't do skills again. But on the 1st, 2nd, 3rd, we'll do clinical cases. So every 3rd Thursday, we're going to talk about clinical cases. I want to present cases to you, discuss cases and so forth, because those have been, they are obviously very, very helpful.